Assalamu alaikum. I'm Dr. Thaslim Kassim from Fargo, North Dakota. I'm a practicing cardiologist. I'm here as part of the NANMMA's Health Bytes series. I'm going to discuss some health tips which can be observed during the month of Ramadan. Fasting means not consuming food or water for hours, and as a result, diet during Ramadan is all the more important. Using the right kind of diet and lifestyle, we can turn the fasting hours into resting the body and ultimately benefiting from it. I'm going to discuss a few tips. I'm going to divide it into 3 or 4 tips. First and foremost is not to skip the suhoor meal. Suhoor is a vital meal in the month of Ramadan. It is advisable that you consume food which is similar to that which you eat for breakfast. Suhoor gives you strength and vitality for the rest of the day and make fasting more tolerable. Make sure that the food eaten during suhoor is rich in slowly absorbable carbohydrates. The reason being the blood sugar levels are released in a more sustained fashion. The food includes whole grain, wheat, breads, and cereals. Also important is to include proteins like milk, yogurt, and eggs. It's also important to include some amount of healthy fat during suhoor. Another important thing to mention is to keep yourself hydrated. Drink at least 8 glasses of water for the entire day. Start drinking fluid at regular intervals right from iftar all the way to suhoor. Also, it's important to stay away from salt or sweetened drinks, as these can induce dehydration and make you feel thirsty. Another important thing to keep in mind is to avoid caffeinated drinks, especially during suhoor meal, as these can cause a diuretic effect and accelerate fluid loss, especially during the early hours of fasting. Third most important thing is to get adequate rest. It's important to have at least 6 to 8 hours of sleep a day. As we know, it's difficult to get 6 to 8 hours of straight sleep during night, so it's important to take rest during the day. I would say to stay cool and rested during the most hottest part of the day, and so this can avoid dehydration. Also important is not to go to bed immediately after iftar or suhoor. Now let's come to the iftar meal. As Prophet ﷺ has mentioned, it's important to break the fast with dates. Dates can act as energy buster and provide much needed energy after a prolonged energy deprived state. It's important to follow up that with an appetizer which can include fruits, juices, and soups. It's important to avoid fatty soups, as this can cause adverse effect. It's important to keep at least a 15 to 20 minutes gap after the appetizer before starting the main course. Main course should include complex carbohydrates and fiber-rich food, as this can help in preventing constipation. Also important is to include plenty of vegetables, grains, and lentils during the main course food. It's important to avoid fried, oily, or sweetened food in excess, as these can easily get digested and can also result in weight gain. Very important thing to remember is to not indulge in overeating, as these can result in indigestion and weight gain. Drink plenty of water during iftar. Another thing which can be missed but it's very important is exercising lightly during the month of Ramadan. It's important to maintain a gentle exercise regimen throughout the month of Ramadan. I would say to opt for light exercises or yoga or walking rather than indulging in grueling regimen of hard-hitting exercise. If you're still very particular to go to gym, I would suggest going to the gym after an hour or 2 after iftar. Now I'm going to discuss in brief about some precautions which patients with heart disease need to take during the month of Ramadan. Patients with active heart disease like congestive heart failure or active coronary artery disease need to take extra precautions, especially with diet and their medications. Most of these patients will have medications which need to be taken twice or thrice a day. They need to consult with their cardiologist and see if there are alternatives like once a day medication which can be used instead of twice or thrice daily medications. Patients with stable heart disease or with no symptoms will have no harm in going through regular fasting. I think instead it would be beneficial for these kind of patients as that can result in lower food intake and stopping other habits like smoking. A quick note regarding the dietary habit for heart disease patients is to consume small portion meals. Try to consume 4 small meals instead of 2 large meals. Also avoid fatty and salt rich food. Also avoid large quantities of beverages. All these things can overload the heart and can result in exacerbation of conditions like heart failure. Also important is to maintain a light physical exercise in heart disease patients.